Say before walking in. Hi.
Hi.
Hi. My name is Cindy Ryan. I'll be doing your assessment today.
Oh, nice to meet you.
You as well. What's your name, please?
Oh, I'm Rachel.
Rachel, hi. What's your date of birth?
Oh, 2/27/93.
2/27/93? Something like that. And how old are you now?
Oh, I'm 21 now.
21. Okay.
Okay.
And so what I'll do during this is I'll be thinking out loud. This is obviously not what we say to the patient in front of them, but we're doing the thought process, right? So I'm thinking to myself, she appears younger than stated age, but she's nicely mature, so over 23 years old. She's well nourished, well developed. That her skin has nice pink tones to it. I'm not seeing any icterus, not seeing any jaundice at all. I'm just taking a general look at her. That I'm not seeing any obvious physical abnormalities or deformities. That when she was walking in, she was moving all extremities well. Her gait was steady. She was able to hear me ask questions and respond appropriately. And whether she was reading lips or not, we'll find out more later because I'll assess hearing further as we go through. Okay. Affect. She's dynamic in her affect. Excellent eye contact. Appropriate for the situation. She has excellent hygiene with this as well. And as I'm going through the whole well-nourished, well-developed, athletic build, looks like to me. And so as we're going through, then I'm trying to do my mental list. And of course, at this point, I'm not remembering the list from the book, so we're just going to play it. Okay? So what I'm seeing and what we'll assess there is atraumatic normocephalic. Looks like from here. I'll assess it further in a bit. No physical abnormalities, talking about that. Affect. Pleasant posture, sitting and erect, relaxed, no problems there. Moves all extremities, we talked about those. And that's fine, we'll move on. Anything else on your list? Good. Before I get started, I'm just going to wash hands because I have been touching all sorts of stuff, so I'm going to bolt through you guys again. Okay, we'll talk as we go. So, what you want to do then as you go through is that think out loud. Okay, so in your videos, truly just think out loud. If you repeat yourself, it's fine, okay? And then you can just go ahead and do your mental list, okay? All right, so coming back through. What we'll do is, in your book, they talk about starting with the hands. Bates, we start with the head, so I usually just start with the head. Is that okay? All right. So, adding more stuff to the pot. Thank you. All right, so with this, I'm just going to take a look at your scalp from here. If you look at it slightly. Now, because she's got this very nice braid, what I'm going to do is work around that. If you have someone that has impaired hygiene, wearing gloves could be recommended, okay? So what I'm seeing is, I'm not seeing any rashes, I'm not seeing any lesions, I'm not seeing any nevi. Have you ever felt any lumps, anything different?
No.
No. I'm not seeing any infestations. Is there any pain or tenderness whenever I check your scalp here?
No, it feels nice.
Okay, good. And so there's no tenderness on the scalp, okay? So normocephalic atraumatic. With this, being able to then come on around, taking a look at the face, she's got good facial expression. And so with this, we can go ahead and start then with the eyes. What I'm going to do is have you cover your right eye. Good. I'm going to cover mine. And then I want you to tell me if I'm holding 1 or 2 or 3 fingers whenever you see them come in.
Okay.
You'll be looking with this eye, okay?
Okay.
Ready? So, tell me what you see.
I don't see anything. Oh, I see one.
Okay, good.
I
And
just
still
kind
look
of
at me.
Two.
Good.
Oh, two.
Yes. And then coming around here.
Okay, I see 1, 2. Dang it.
And she's looking over to my finger and it's fine. And so in patients will be curious too. Will they sometimes look? Sure they will. We don't count that all further. We'll just say, take a look at mine, let's try that one again. And we'll go ahead and do that field, which is fine, okay?
Right.
I know. And so with this, and so she's doing fabulous, okay? So, and we would do the same on the other side, okay? And so with this, now what I want you to do is just keep your head straight. Watch where my fingers go. Coming all the way over to the side. Excellent. All the way up and around. And what I'm checking here is cranial nerves 3, 4, and 6, and all the way in. Excellent. Okay, so also then with accommodation. So with this, her EOMs are intact. Then in addition to that, we'll go ahead and check. Thank you. Go ahead and check the rest of your eye structure. If you will, please just look straight ahead.
Okay.
And what I'm noticing is the light is reflecting off the same place in both eyes, so the eyes are tracking well and they're symmetric. And with that, just looking at general eye structures. What I'm also seeing is that the sclera, nice and white. The conjunctiva, no evidence of any inflammation. She also is nice and pink, so there's no evidence of anemia with that as well. You don't have to do all the diagnostics, okay, but it's not pale, okay? Eye rides are symmetric. I'm not seeing any evidence of trauma. I'm not seeing any inflammation around the borders, okay? And then also on the cornea themselves, they're nice and clear. I'm not seeing any opacities, okay? And so with that, I'm going to take then look in your eye structures if you can, okay? First, take a look at my nose. It's going to be a big bright light. Hopefully a big bright light. We'll find out how well this is working. Look in here. Bright light. Bright light. I'm checking direct and consensual on the pupillary response, and she is nice and brisk pupillary response bilaterally. With this, we would dim the lights for purposes of your guys' visibility. I'm not going to dim the lights. You will want to do your own, making sure that you are in focus on your ophthalmoscope. And so remember, find a place where there's a wrinkle, have it well in focus before you start looking at the person's back of the eye. You're at the same distance. And then have her stare off somewhere where hopefully it's dark, where it's not here. So I probably won't be able to see anything, but we'll walk through it. So if you'll stare at the top edge of that box up there, it's going to come in and get in your way, okay? Just keep your eyes right in that place. What I'm seeing then is, yeah, not much. Okay. And, yes, we just had battery death. Let's see here. And this is the part where we talk about charging. So what we're going to do is stretch. I think I'll find out if this works. Here we go. All right, so what we'll do then is go ahead and make sure that you've got your, all right. This will be for the motions because we have next to no light coming out of this thing. All right, okay. Staring up there. And then what I'm going, because I'm not going to talk in my patient's face, what I'm looking for inside is going to look for blood vessels. I want to be able to see that they track back to the optic disc, whether there is any evidence of any edema, pressure, or anything there. And then see if I can see the macula. That'll be nice, but it'll be a miracle. We'll see. So take a look at that box. I'm going to come and get in your way. Looking for red light reflex. Get the red light reflex. Chase it in. I know, I got you there. So we got the disc. The whole thing, don't kiss your patient, never kiss your patient. All right, so with this, we got all the way back. Vessels are nice, right at the disc whenever the humor hits. So disc looked okay as much as I could see before, and it didn't get a chance to see the macula, and that's fine. No problems, no worries. Okay, so you can say what you can see. Do you not pass if you're not seeing structures? No. I want to see that you're seeing the process, okay? Everyone's eye is different, and eyes are different, and sometimes we'll be able to see better than others, and sometimes not so much, okay? And so just being able to be honest about what you're seeing is fine. Okay, so the eyes looked all fine with that. One of the other things in coming around, being able to then go through the rest of the face, the order is slightly different here, but you can check for sinus, so I'm going to press here and here. Any pain and pressure, any of those? Good. So frontal and maxillary sinuses, no pain or pressure with that. With your eyes, I want you, the facial muscles, I want to be able to see how they move. So do what I do. Raise your eyebrows. Good. And down. Good job. And then close your eyes really tight. Don't let me open. Good. And then open. Now smile. And then frown. Good. Tight. Make your jaw tight. Good. Open, close. Any pain whenever I push here? Mild click on the right. Okay. And so she's got a mild click on the right, no significant pain. While I'm here, I'm just going to go ahead and check your temporal artery. And we're getting good +2, nice +2 bilaterally. And there's no roping, no increased warmth. And does it hurt at all when I'm pushing here? No. Tighten your jaw really tight. Don't let me open. Good. And so cranial nerves 7 and 5, checking both with muscle motion and all the rest. And then I'll have her close her eyes, find my little cotton swab. And for purposes, then I'll have her close eyes, and I'll just say, does this feel? And I lightly touch with a cotton swab, all 3 areas, right? So we're hitting ophthalmic, maxillary, and mandibular tract. Did that feel essentially throughout? Okay, so that's pretty close. Use your cotton swab, it's fine. I'm going for time. Okay, so we've got all the way through down through there. We've got eyes. Anything else on eyes that we need to hit before we go? Good, fabulous. So yes, stretching. Okay, good enough. All right, so then what we want to do is go ahead and go down. Now, everyone has individual personal preference and order. I'm going to go ahead and check ears next. If you look that way. Now, on process, I'm looking and saying, if you look straight ahead first, symmetry, well aligned, not lower than the corner of the eyes. Okay, exactly. Nice. With this, we go ahead and go through and check for if there was any tenderness. Okay. Also, we're checking for if there's small nodules Darwin tubercles, anything else. Any pain or tenderness with this?
No.
Nothing at all? Okay, good. And so I'm going to just take a look in your ear. All right? All right. With this, being able, again, adult lifts how? Up as far as the head, right? So being able to come on in here. Oh, very nice. Cone of light is nice and intact, inferior, anterior quadrant, and on this, nice and translucent, no injection, no bulge, no retraction, tympanic membrane intact. It's nice, isn't it? I would do the same on the other side. And so with this, the nose, I'm going to take a look at nose. I'm varying this a little bit. Look up slightly. Excellent. What I'm seeing is septum is nice and intact, okay? Midline with that. If you'll occlude one side of your nose and then breathe in and do the other side. Excellent. And so patent bilateral on the nares, okay? We've already checked sinuses, so is there anything else we need to do on those? Smell. And so if we're doing cranial nerve 1, which by the way, it's not in your list, I don't think, but if we were, we'd go ahead and check our smell. Now, routinely, smell is not checked in a standard acute care environment. Cranial nerve 1, we routinely don't test unless there's an issue or problem. Most people aren't walking around with cloves in their pocket to test this, okay? And so with that, it's just something that we note if they say that they've had any abnormalities in smell, okay? We've already checked sinuses, we've got nose then, we're going to go ahead and check mouth. Say, ah, good. Cranial nerve what? We're checking ah, and then tongue straight out, and then side to side. Excellent. Good. And so with that, things that would be handy.
So, Tim, you were
uh-huh.
saying is the gag for is how we're assessing Tim.
And we also, and as these gloves are a little discolored, so I'm not going to stick my hand in your mouth with a discolored glove.
Thank you.
Routinely, we would go ahead and stick the finger in the mouth and be able to assess the edges of the tongue. Instead, what I'm going to use is a tongue blade to be able to just turn the tongue from side to side. And then also for the gag. Sorry about this. Okay, I'm going to check inside first. Here. Dentition is very nice. You got good hygiene with that. We go ahead and count the teeth if we're doing a full physical, but on hers, I'm not seeing any missing teeth, okay? Underneath the tongue, sublingual is fine, and go ahead and bring your tongue back down again, and say, oh. And tonsils were at a nice, just barely, +1 with that. And check gag. Apologies, head. 1, 2, 3. Yeah, so mild gag reflex, we don't need to go any further. We talked about vasovagal, right? No need to induce. All right, so with that, mouth structures all look fine. I'm not seeing any inflammation, not seeing any caries that are not addressed. She's got good hygiene with that, and uvula rise with phonation is midline. So all that looks fine, okay? Good. Stuff. And then we would routinely have, we would routinely have a trash can or something close by. Just in case needed. All right. This is where also, in going through, we'll have your names. So, submental, submandibular, jugular-digastric, preauricular, posterior-auricular. I always go ahead and check tragal and mastoidotendinous in the canine. Good. Good. Superficial cervical. And then going deep here, apologies. Deep cervical chain, posterior cervical chain, occipital, supraclavicular, and you can also have them just bring the shoulders in slightly to be able to get in that groove if you need to more. Okay? So everything there looks fine. With this, I'm just going to take a look at your neck. I was already noticing that it's midline. Thank you. Looking straight ahead. Go ahead and just swallow. And I know she's swallowing easily, that her trachea is midline, that it's non-mobile. There's nothing that feels unintact. No problems there. Now, on this one, good. And carotids are fine. She's got a +2. Take a nice back in and out and hold. That was allowed.
Sorry.
Examiner's hearing is intact. So, all right. So there's no bruise on the carotids. We check the same on both sides. So at this point in your option and in your list, I'm going to go ahead and do the head and neck strength for neuro and work down. So with this, if you'll push against my hand, good. Pull back. Good. Ear to shoulder.
Oh wait, that way.
Ear to shoulder. Turn left no against my hand. Left no against my hand. And shrug. Good. Now we're going to check your arms as well. Bring your arms up like this. Don't let me push. Don't let me pull. Excellent. Go like this. Don't let me pull. Don't let me pull. Don't let me push. Excellent. Then with your hands, do like me. All the way up, all the way behind. So range of motion is nice and intact as well. And then cranial nerves 9, 10, 12, we're out of it. Okay. So with this, if you'll do your fingers like this, don't let me break. Good, excellent. Open your hands, both sides. Take my 2 fingers, squeeze it tight, don't let go. Don't let go. And this is another way that I generally check for just the symmetric strength, okay? And so with that being able to have the pull. And so she's got excellent 505 strength throughout, full range of motion, and going through all the other extremities. So let's go ahead and we'll go to the thyroid and checking from the back. At this point,
I have a quick question. When you're doing the ears, are you going to go ahead and do the whisper test?
and in fact, this is the part I'm bringing back to the, my brain wants to click into clinic mode. And in clinic mode, we're testing gross hearing, but we're not always testing whisper tests. So this is where I want you guys to bring me back. If I'm leaving a body system that is on your list, make sure and bring me back there, okay? So what I'm going to have you do is take this hand, occlude this ear, and then be able to tell me. And you can do the tragus and just lightly move the tragus, okay? Then what I'm going to do is I'm going to whisper a couple of words and you tell me what they are, okay? So you go ahead and do that ear. I'm going to whisper a word. Ready?
Vacation.
All right, good. So on the ears, was there anything else on your list? Okay, and I think that was the covering on the rest. What we don't need to do is Renee and Weber. Okay, so for the purposes of this exam, we don't need to do those. Checking the thyroid from the back. Okay, so on the thyroid, again, if you'll chin down just a little bit, coming all the way down, and assessing here. Good. And this one. Excellent. And so with that nice and smooth, great mobility, and actually so with that, everything there looks fine. So if you'll go ahead, can you slip do you have a shirt on underneath?
Yes.
Okay, excellent. If you'll slip the jacket off, what we're going to do, since now, I'm going to hold this down. Since we're at the back now, what I'll go ahead and we could pause. If we were doing our real video, we'd pause. I could look at my paper, see if I've missed anything. I'm using you guys as a shared brain, so I'm not going to look at my paper. You yell if I miss anything, okay? Because I want to make sure and demonstrate it for you. So while I'm here now at the back, I've already done thyroid, but while I'm back here now, we want to just roll it into posterior lungs. So as we're going through, there'll be times when I'm listening, times when I'm pushing, times when I'm tapping, times when I'm listening. If any of that makes you at all uncomfortable, let me know. If you have any tenderness, please let me know. Okay? So right now I'm just looking at how you breathe. Take a nice deep breath in and down. So what I'm seeing is AP and lateral diameter. She does have the 2-to-1 ratio. It's looking fine. She's got wider lateral. So go ahead and take a nice deep breath in again and down. Good. Chest expansion is nice and symmetric with that, and her skin is nice and intact if I were seeing it. And so with this, we're going to go on that presumption. Also verbalize, and at the beginning with the skin color, you can say, I'll be checking skin throughout each region. So skin is nice and intact. I'm not seeing any unusual lesions. I really am not seeing any unusual lesions. So the pink tones and everything else is fine. All right, so with that, being able to go through, it's going to feel a couple different places. In a deep voice, say 99, 99, 99, 99. So tactile firmness, and she's symmetric throughout. I'm not feeling any localization with that. Just going to press a few places here on your back. Is there any tenderness there? No. Good. And I'm not feeling any unusual lumps, bumps, anything else, and there's no point tenderness with that. So we've done inspection, we've done the palpation. Now we'll go ahead and do percussion. You can do one side. I'm going to be inadvertently flipping back into my clinic mode, so if I'm doing both sides, you actually only have to do one. What we're going to do is go ahead and check your diaphragmatic exposure. That means how much your lungs are moving, okay? Your diaphragm is moving. So if you'll take a nice deep breath in, and out, and hold. So make a mark on her back. Take a nice deep breath in again, and out, and all the way in, as much as you can, and hold. She's got nice lungs. Okay, so go ahead and breathe. So we've got a nice 5 to 6 centimeter. We pull out our ruler, we'd go ahead and measure, and we'd say we do the same on both sides. Then with that, we can go ahead and move forward. But we would expect it to be that 3 to 5 centimeter or the nice and athletic lungs. While we're back here, let's go ahead and check vertebral tenderness. Is there anywhere where I push where it hurts? Okay, so now I'm going to thump on you. Ready? Thump and thump. Any pain when I thump? So no vertebral tenderness. I hit her pretty hard, but no real CBA tenderness, okay? And so all of that part is fine too. Before we leave the back, was there anything else that we needed to do? Anybody look at your book? Okay, so we're going to take all that and move to the front. For purposes of time, because I think we're getting cruising down pretty much. On your video, then you go ahead, I'll check firmness again. 9. On females, we work around the breast, okay, not on the breast itself. We go ahead and do we would go ahead and do palpation around, and we would go ahead and do the things I learned while I'm up here, right? So with this, being able to go ahead and then do auscultation as well. Now, in teach mode here, I didn't catch on breath sounds back here. Before I left the back, anybody who was looking at your book, we would do obviously breath sounds. We would be doing it on skin. We would ask the patient not to hum songs while we're doing this. And we would do breath sounds, and you want to catch those 8 areas, so you're even coming laterally. Then whenever we get here, we're again doing our inspection. We're doing our palpation, we're doing firmitus, and then we're doing percussion throughout the fields to make sure it sounds tone and symmetric. Go ahead and do auscultation. This is one thing, I don't know if we talked about it in lab, so I want to make sure I mention it to you now. If you'll use the bell, and you go all the way up to the very top, you'll catch the apical breath sounds where otherwise you can miss them. So come into that V groove right here. Nice deep breath in, and down. Excellent. And relax your arms. Good, excellent. And come right over here, deep breath in, and down. Now, she's wonderfully lean, and so getting in that groove is a little tough, so I'll come right below the clavicle. Deep breath in, and down. Since we're right below the clavicle, we've got more physical space to work with, and so you can flip back over to your diaphragm and be able to catch far up to the apices there. We would then, of course, listen throughout. Female patients, just have them hold their breasts up, be able to listen under. While I'm there, I go ahead and catch heart sounds, okay? So if you will, please just hold up. And what I'm going to do is, okay, so what I'm going to do is, we've done lung sounds throughout catching laterals as well. Going to come back and start with heart.
I feel bad videoing this, I really do. Get myself in trouble is all I do.
And then, if you have the dual head stethoscope that we're talking about, you can simply press firmer to be able to change from diaphragm to bell. Otherwise, we'll just work up, and then relax, thank you, and then here. And then, because we would normally be on skin, we could hear better. S1 is 2 is clear, no more with rubs, and switch over to bell. Excellent. And be able to go back all through the stations to be able to catch heart sounds. Okay. So we've got all the heart there with that. Being able to get PMI if we were doing that. In this case with the video, I don't think it's required on theirs. But being able to measure, if there's anything that we see that's concerning, we would certainly address that. All right. Whenever I was looking at her neck before, I didn't see any JVD, so I'm not concerned about being able to do the measurements there. There's nothing visible that's concerning. When we have her lay down, we'll take a look further. Okay, so with all that, I'm not seeing anything unusual with that. Cardiovascular checkoff, anything else?
Most patients who use apical impulse.
And so that's especially useful when laying down. So oftentimes we'll have them go ahead and kick around and lay down at that point. The question is whether we can use this for a pillow. All right, if you can go ahead and switch around. So on the apical heaves, I'm just going to have one on your chest. Okay. And press it over. So I'm not feeling any unusual heaves, thrills, and for apical impulse, for that point, on female patients, it's often difficult to get to, but she's about right there. So she's where anticipated fifth intercostal space, mid-clavicular line, or just lateral, and the PMI is not enlarged with that. Okay, as she's laying down, I'm not seeing any unusual jugular venous distension. Vasculature looks normal to me on that. There's no excessive volume visible, okay? So with anything else cardiovascular, if I needed to, I could check my paper. We've changed positions on that, and that part's fine. With that, I'm going to have you bend up your knees, put your feet flat. For those of you who are looking, yeah, if you can work around. Now, again, we would be looking typical patient at skin, so we'd be able to see. We're looking for, so assessing, we're looking for contours. It's nice and flat. There's no unusual pulsation. She has nice even respirations. They're unlabored. Would not be seeing any intercostal muscle uses with that. I'm especially looking for pulsation. Now, she's leaner, so we see a pulsation. Is that expected? Yeah. With a lean person, it's fine. So, seeing the aorta already there before getting into the deep palpation, I'm actually going to check that width. Before we manipulate the belly, however, we're going to go ahead and check for our vascular tones. How many places?
4.
7. Keep going up on the number. How many places? Keep going up on the number. How many places? 7. If you had 7 fingers up, you're right. So, aorta,
7.
renal,
Okay.
iliac. And then I have her straighten her legs down and catch femorals, okay? And so be able to catch femorals and be able to do that side to side. I'm not hearing any bruits. And then if I heard vowel sounds coming through at the same time, then I'm good on vowel sounds. If not, I'm going to go, and I would say that I hear vowel sounds. If not, I'll go ahead and flip over to diaphragm and be able to go ahead and listen, starting in the right lower quadrant is where it's going to be most active, and being able to listen throughout, okay? And so that part's fun. So with that, I'm not hearing anything that's unusual, no vascular sounds, no bruits, and vowel sounds are good and active. So you can go ahead and bend your knees back up, put your feet flat. Thanks so much on that. So we've been able to do inspection, we've been able to do the auscultation. Now I'm going to tap, okay? Female patients, again, if you'll take this hand and just hold that breast, there you go. And then that way it allows the privacy barrier. And so she really, we're not going to be able to catch upper liver border, okay? But by listening, again, listen. Already she's switching out, and I'm not even past the costal border yet, okay? So she is well up there, so I'm not concerned about hepatomegaly. So with that, what else we want to percuss is spleen. Nice deep breath in. And down. And actually, where I started on her was, yeah, I'm at the lowest. So lowest intercostal space, that anterior axillary line, and no shift to dull, so no enlargement there. And then just the normal tympanic tones. Okay. And I'm not concerned, sorry about that. And I'm not concerned about any, there are no concerning sounds. I'm not hearing any concern there. So nice deep breath in, and out, and in again. Excellent, and out. Now, when I feel fullness, you tighten your muscles really tight, and it was a muscle, and relax. So my assessment of athletic before was accurate. So what I'm feeling here was just a muscle border, and there's no hepatomegaly that I'm able to palpate here. So just coming all the way around. Have a light palpation. And now it's uncomfortable for me to push, but no pain? No. Good, okay. Yeah, I'm sorry about that. Well, and the other part is whenever we get near the, when you get near the liver and you're pressing, they can sometimes get that vascular whoosh because of the pressure on the liver. Try not to be giving them that full compression, okay? But just understand they may feel that little fullness that I was just talking about. Okay, so I'm not feeling any unusual masses with that. And we talked about the aortic pulsation, but actually had not narrowed it in. So before you do the palpation on the abdomen, and you can do it as soon as you think of it, but before you do the palpation on the abdomen, check aortic width. So you start wide, fingers in, until you get pulsation on one, then walk the other one closer until you get where you have pulsation on both. And it's not always right there where you can feel it. Sometimes, especially muscular, you can sometimes have blunting through the muscles. But I'm not feeling things wide or concerning. If you're feeling pulsation on both and your hands and fingers are this wide, do you continue with palpation?
No.
Please don't. Okay. And so with that, being able, and yours is totally fine. It's not there. Okay. So then as I'm doing that, also lymph nodes and pulses. Now on your video process, if you'll straighten both legs, on your video process, again, your patient may not want to expose, so it's fine to do it on top of skin. So you can say, I would check the nodes here, okay, and be able to explain to the patient what you're feeling for. And I'm not feeling unusual lumps or bumps, and you check the pulse. And she's got a nice +2, I'd go ahead and check both sides, okay. Now, just FYI for you, where you have mons, the hairline, and where it comes into the angle of the inguinal angle, that's oftentimes where the pulse is. So if you're having a difficult time finding, just eyeball that area, or you can have the person bring their leg out, and that can also help you to find that pulse, okay? Anything else before I need to leave abdomen? Okay, so with that, now a couple of options. For checking her feet while they're handy and up here, we can have her slip off both shoes and go ahead and do, and we just need one, because we'll do one and say check the other side if you want to. We'll do, you do through socks? Okay. So, on this, since she has so graciously volunteered, we will not expose non-manicured to make it uncomfortable. So, here we go. It's okay. All right, so with this, couple of options then. One is to be able to have a paper clip. You've got your tuning fork to be able to check for vibration. We have for sharp dull, we can just do a paper clip. And if I can see your hand for a second, this part is going to be sharp, this part's going to be dull. Okay? All right. So you can close your eyes, which pretty much you can't see down here anyway, and that's great. So you can straighten this leg out. So then as she either has her eyes closed, then we can check a couple things. One, we would check for pulses bilaterally, right? So we're going to go ahead and check and see. We've got nice +2. We're going to go through the socks this time, but you'll be doing skin, and we'll pretend like, yes, capillary refill is great, okay? And if in doubt, or I had a patient that had a partial amputation. So we just check up here. Anywhere you have skin, you can do a capillary refill. You just go to the distal part of whatever extremity is left, and just do the capillary refill on whatever part of the extremity. They had they were amputated here, and so it was simply on the stump. All right, so on that, I want to just check for vibration. And with that, this is vibration. I'm just going to see your hand for a second. It'll be vibrating, if I can actually hit it, okay, and then it could stop, okay? So what I want you to tell me is when you feel it vibrating, and then tell me when it stops, okay? So with this, distal point.
Vibrating.
Tell me when it stops. Okay. All right, so with that, being able to check for that, I want to check something else here, and that is, I'm going to move your toe, and tell me if it ends up, down, or straight, okay?
Down. Down. Up.
Okay, so what we're checking there is position sense, also referred to as kinesthesia, okay? So position sense with that. Sharp, dull, then being able to tell me if it's sharp or dull.
I think that's all.
I know, through socks it's really blunted, right? Okay, so here.
Sorry.
Sharpish? Okay, and so with that, if she has an area where there seems to be variation, just be able to come back to that area as you're going around and see if it's accurate on the second pass. And of course, the accuracy is better whenever we're not going through socks. Okay, so everything there was fine. Now on her extremities, we were looking at whether there's any edema, and I'm not seeing any edema. We're looking at skin tones, nice and pink throughout. We capillary refill. So whatever elements go there. Circulation, you want to assess that. Skin element, assess that. Neuro, we've assessed then through those various maneuvers. Anything else on legs that we need to assess? So we'll let you sit up. Now, while you're sitting up, I'm going to bring you around this way, because you can actually sit that way because if they can see better. Neuro on the hands. Neuro on the hands, we usually do sharp dull, so we'd repeat same process. We would check capillary refill while we're here. Very brisk, it's immediate. We would also check position sense, right? So close your eyes, tell me where your finger ends up at.
Up. Side.
Exactly. Okay, so I'm moving a little, so she really is wonderfully intact with that. Then if you'll close your eyes again, I'm going to write a number in your hand. Tell me what that number is.
2.
Yes.
6. 7.
Excellent. And so with her graphesthesia, she's fine there. Exactly. Thank you. Give her support and come on through. We're going to pretend like, yes. How to know you have a nursing student. Close your eyes. Tell me what I'm putting in your hand.
Oh, it's a thingy I covered.
Exactly, a thingy. Okay, so we have an otoscope ear cover, which she indicated with her finger, so we've got, at least she's identifying it well, okay? We've done sharp dull. If we didn't already, we want to check bilateral radial pulses. And she's nice and +2 bilaterally. And then, of course, all those things that we check for the neuro element, we'll check on the other side. I've got an itchy feeling of forgetting one thing. I would check my paper. I'm using the universal paper of you guys. Is there anything else on upper extremity besides reflexes that we need at this point?
Cerebellar function.
Oh, the finger, nose, finger, they put it here. I couldn't remember where this book put it. So with this, we'll check 2 things. If you'll scoot to the edge of the table, but there's a hole, so if you're falling through, you okay.
Are you on upper, because that's
I'm
like
surprised
all
my
your
phone's
stuff
going
you
this
just went over is
long.
on the neuro.
It's on the neurosection in the back. And the question is, while we're here, because we've gone through, we've done head and neck, we've done chest, we've done abdomen, we've done extremities with capillary refill and all the rest. So with this, with the neuro elements that are residual, cerebellar function, we want to check a few things. One is, the finger, nose, finger is, if you will, take your own finger, touch your nose, and do it both sides, and close your eyes while you're doing it. Okay? Close your eyes. There you go. Keep doing it on the other side too. Keep your hands straight out while you're doing this. Both sides. Because, exactly. Because, no, do one at a time. Open your eyes for a second. This is where, if instructor is giving information, that's okay. So what I want you to do, this is actually a really good demonstration. Thank you for doing that. You want to be able to have them do what I do. And exactly, you're going to touch your nose versus I'm not, because I don't want to touch my nose and back. But I want to have you close your eyes and then do that and get progressively faster. Okay? So close your eyes. Go ahead and I know. James. Okay, go ahead and just check one. And check the other. Good. And go faster. And go faster. And go faster. Excellent. She's fine. Okay, so with that, another way that's not in your book necessarily is you can have them do hands on the lap. And you can do flip the hands and see, again, coordination of movement. Symmetry of movement. Okay? Now, the legs, this one is in your book. If you'll take the heel of one foot and just take it straight down the shin of the other side. Excellent. Do that on the other side. Excellent. And so the heel to shin is fine with that. All right, we still haven't checked reflexes, so I'm going to go through reflexes with this. And again, check one side and say I do it on the other. If I can borrow your arm for a moment. And we're going to bring it this way. There you go. Close your eyes. Think warm, sunny beaches. She is not relaxed because when I push her here, it's not free swinging. There you go. Excellent. And so with, it's all right. And so with a very slight motion with this on hers, so it's a +1. So, triceps +1. And so with this, one, we have a very hard hammer. Very slight on the +1 there, she's fine. And actually on that one, you're good. And so the biceps, and then on the brachioradialis, two options. One is here and being able to feel the fingers. The other is you can hold the thumb up and be able to check, and you're looking for these fingers very slight on the responsiveness of that. Apologies on you because whacking with the hard one. Okay. Lower extremities. So we had triceps, biceps, brachioradialis. On lower extremities, we'll have you uncross your legs. There you go. Close your eyes. Think warm, sunny beaches. Okay? Warm, sunny beaches. So she's got a nice +2, almost a +3 response on the knee. Do the same on the other side. On this one then, with Achilles, and she's got a nice +2 on that one as well. And then Babinski, and and toes down going, or a negative Babinski. We would do the same on the other side. If we needed reinforcement on the knees, then we would have her hands like this, curl them around, and whenever I tell you, you're going to pull them hold tight. So close your eyes and pull. And so you can see it's even more of a brisk response. So reinforcement can be very beneficial there. Sorry about that. Okay, so with that. All right, so with going through on all the rest, so we're checking for symmetry on responses, not just if it's present. Now let's go ahead and check gait and a few other things, okay? So I'm going to have you hop down here if you will, please. You're fine to leave your shoes off. Romberg. One thing I want you to have to do is, if you'll stand about here, facing that way. Now you're good. I'm going to have you turn and face the door. I'm sorry. Turn and face the door. There you go. Because I have a place where she can sit behind her, but she's not leaning against it. So Romberg is feet together and just standing, but we're going to add plantar drift, pronator drift. So I want you to put your hands out like this. Okay. Now I just want you to stand. Notice I'm guarding her. Okay. Close your eyes and just stand. We'd let her stand for 30 to 60 seconds. She obviously is fully intact, no sway or anything else. So you can open your eyes. And we'll have that for 30 to 60 seconds. So Romberg is negative, pronator drift. She has no pronator drift with that. I want to assess your gait now. And so we want to find a straight line. On this one that runs toward the door, would you please walk with the heel to toe and just follow that line for a little bit. Excellent. We have her keep going, but this now we'll have her go ahead and turn around, come back. And it doesn't have to be right together, but do on the heels, on the balls of your foot. Excellent. And then if you will turn around and head back, and this time walk on heels.
That's hard.
Excellent. Now on the heels, she was doing an excellent job of still following the straight line throughout, and sometimes they'll be slightly off of the midline, but you're looking for stability on walking heels. Okay? So gait is steady and very nice. Okay, on your range of motion also, a couple things. One, we're just going to check strength. So what I'd like you to do is on one leg, go down and do a shallow knee bend. Excellent. Come back up. And go ahead and do it the other side. Excellent. Come back up. 5 over 5 strength by lateral lower extremities because they wouldn't be able to come back up on their own if they didn't have that full 5 over 5 strength. For your spine range of motion, I want you to face away from me. What I'm going to do, and again, this would be with skin, but what I'm going to do is support you here and have you just, I'm going to stand behind you and look at your spine as you go. If you'll do your hands together, and then just go down and touch your toes and come back, okay?
About that.
Yes.
Keep it that way.
Okay, and then going down, and then coming back. Now, if she had shirt off, we'd be looking at that spine, looking for scoliosis, correct? Now, what I'm going to do is support you on your hips because I don't want you to fall, but this is what I'm going to ask you to do. If you'll go to one side, and then go to the other side, and then I'm going to have you lean back, and then I'm going to have you just turn at the waist side to side, okay?
Okay.
So go down one side, good, excellent. Go down the other way, come back as far as you can, and I dodge out of the way, excellent, that's fine. And then with that, if you'll just turn, keeping your hips straight, excellent. So spinal range of motion is nice and intact. She has full spinal range of motion. All right, so she's done gait, she's done neuro, we've done spine. What else is there on your list?
Who was the feet jugular vein thing where you measure?
For the measuring, only if we see jugular venous distension do we need to do that measuring component. And so the good news is you don't have to routinely do it. However, if you do see that going on, do you want me to just run through that so you see the process again? Are you guys all intact? Okay. So you're not going to see it on video anyway. It'd be the 45 degree, 30 to 45 degree. You're looking at the upper edge of their pulsation and how far that is from their second intercostal space, and it should be less than 2 centimeters. Okay, straight line over. Okay, other questions?
On the video, do we need to actually mark with the pen on the end?
Preferably, so that you can actually do the measurement. But if you don't have the pin there, if your patient doesn't want to be written on, you simply say, my patient doesn't want to be written on. I'm looking at it specifically here. And you notice on her, I kept my finger right at that spot while she did the deep breath in and out, and then I just went to the next. If you will do either full inspiration, it doesn't matter, full inspiration or expiration, whichever one's first. You're looking for the difference in that distance, correct? So all you need to do is go down, catch that distance, and then go the other way. Okay, so if she was all the air out, and I found that, now I know her lungs are going to be further down when she breathes in, correct? So I can just stay there. I've got my sight, be able to go ahead and then air all the way in, be able to go down, and that way you still have, you're close to where you can still guesstimate that amount. For your video, we're looking for a mark, how much is the distance, but at least you can say it's approximately 5 centimeters, 3 centimeters. Then that at least gets you close, okay? Even if it's not full credit, that's decent, okay? Or just tell us your patient doesn't want to be marked on. We understand that, okay? Any other questions that we need to demo together? Okay, now, you guys live and breathe? You guys good? So this is the process that I'm looking for, okay? And so, did I pass my class? Yes! So with this, we are truly, because this whole process that you want to go through, every student is, I have not met a student yet who's like, I still got this, you know. And then they have no nerves at all. So if you're feeling at all nervous about it, that makes you normal. It's okay. We understand, okay? Anybody who teaches the class was also a student at one point, okay? So with that, just be able to hang in there and know that. And thank you, our patient, for today. All right. So, did we miss anything on the list that we especially need to review